Hi, today on Chinese Medicine Podcast, I'm going to be answering a subscriber's question about hypochondrial pain, that's pain around the ribs, and poor appetite and weight loss. So if you're not a subscriber already, make sure you click that subscribe button. Chinese Medicine Podcast is a place where you can come to have your questions about Chinese medicine answered and to understand and learn all about Chinese medicine in a fun and easy way. So let's get on to the video today. Hi, it's Marie Hopkinson from the Chinese Medicine Podcast. Welcome back to another episode where today we're going to be talking about stress and weight loss and pain around the ribs. So pain kind of around this area here under your ribs. And this is a subscriber's question. So Mary has asked, hi Mary, just wondering if you could comment on stress causing weight loss, pain along the ribs / appetite changes, and how to increase and put on weight. Thanks again, would be much appreciated for any reply or ideas. So I'm just going to comment on the Chinese medicine aspect of this idea of stress causing the pain around the ribs and how that mechanism of action happens. Now, the rest of the question, I think I've given you a little reply there already, would kind of relate to your individual Chinese medicine diagnosis. So Chinese Medicine Podcast is a place where people can come to get information about Chinese medicine, learn about how to understand the treatment that your practitioner is already giving you, or understand Chinese medicine a bit more so they can go and see a practitioner and you know how a practitioner is going to think about your situation in a Chinese medicine way. It's not a replacement for medicine. It's not a replacement for seeing a Western medicine doctor even, or seeing a Chinese medicine doctor. Obviously, Dr. YouTube can't come through the internet and help you. And the great thing about Chinese medicine is it's so individualized, but that's also the downside of it, where we can't necessarily give you this advice that's a one size fits all. It's going to be based on your diagnosis. So this is just for anyone watching this video, the person who I've made the video for, and anyone else that's watching it, just to bear that in mind. It's not that I'm trying to withhold information or not give you the treatment, but a lot of the stuff you can't access. Obviously, you can't even access acupuncture without an acupuncturist, right? You need someone who's trained to do the acupuncture on you. You don't want to be doing that on yourself. But this will kind of give you an understanding of how we think about a condition like this. And it's a really, really, really common mechanism. So what we need to do is just go back a little bit in time to the 5 elements to think about that. So you have wood, fire, earth, metal, and water. This cyclical movement of things in our body. And what those elements represent are functional systems, and they've been attributed to different organs. So for instance, wood is attributed to your liver. Now, it does mean your physical liver, but it also really relates to the functions that Chinese medicine attributes to wood functions. So if we think about it more of wood rather than the liver, it gets less confusing. Whereas if you think about the liver, people think, oh, do I have a liver disease? Like as in, do I have cirrhosis of the liver? Do I need to have a liver function test or something like that? In Western medicine, the liver doesn't ensure the smooth flow of qi. So it's really the wood function that's doing that. It's this idea of movement, spreading. And I've done quite a few videos on this already, on that aspect. And the other thing I think is probably involved in here is a little bit of fire and a little bit of earth. So you have wood, fire, earth, metal, water. And these elements go in that direction and they generate each other. So if wood is lacking, then it's not going to generate fire. And if fire is lacking, then it's not going to generate earth, right? So it means that then the next one might be lacking. But you also have an interrelationship between 2 organs like wood and earth, because wood is said to control earth. And what that means is it should look after earth. So because it can control earth, it does have the propensity to dominate over it. And that wouldn't be a good controlling it, right? So I like the phrase of looking after, right? So it should look after the earth. It should be the big brother to the little sister or the little brother. It's kind of got its back. It's looking after it. It's kind of helping it and nurturing it. But if that earth wasn't functioning well, it would be able to step in and say, hey, we need to steer your direction a little bit. And that's the controlling aspect. So in a good way, that's how it controls it. But the nature of wood is kind of this overpowering, spreading, moving. And when that does get a bit overpowering, that's who suffers, is that earth suffers. So in this situation, in this case, we've got something where The rib side pain is a wood symptom, or a liver qi stagnation, which relates to wood symptom. Now, why is that happening? One is because you have your liver sitting kind of under the ribs, and that costal area or that rib area is kind of attributed to the liver, right? Because of the location of the organs, but also because the diaphragm's underneath there, and that's a muscle. And what happens is that diaphragm can get tight and then contract. And then that gives people either a feeling of pushing up, so it makes you feel like uncomfortable. So I'm doing that face to kind of generate the idea. And the person often gets sighing, which is like this, that kind of thing, to enable that free flow of chi. So when they've sighed, they're often sighing about what they're frustrated about.
Hello, IT. Have you tried turning it off and on again?
I've had patients in my clinic where I've asked them, they've been sitting there and you've said, hey, do you sigh very much? And they say, no, not really. Like, they don't even notice that they're sighing. So as a practitioner, we kind of look at, well, what are you sighing about? Because that's often the things you're frustrated about, just subconsciously. Now, sighing is a natural function to release that stagnation. So if you've had a frustrating day and you haven't had much exercise and you've been cooped up all inside all day or something like that, it's kind of natural to sigh a little bit. But someone that sighs all the time or can't stop sighing, or, you know, their shoulders are going up and down, getting annoyed. I've had some patients like that too, that kind of, they get angry and the frustration kind of builds up. Now, after you get the rib side pain, and sometimes this can be because of the posture that people are sitting in. So if you're sitting all day, it's not a great posture to be in all day sitting, right? Because that is just putting pressure, you know, putting pressure on the abdomen, and then that squeezes up into the diaphragm, and that in itself can kind of cause the sighing and the frustration as well. So after the sighing, if that's not enough to kind of get things out, sometimes people get angry, physically angry.
Serenity now!
They get, you know, this frustration, anger, resentment, these kind of emotions are all linked to the wood stagnation. So this lady hasn't said anything about those symptoms, just said got the hypochondrial, or in Chinese medicine we call it hypochondrial pain, so rib side pain. Now sometimes people just feel like a relief. I'm going to just stand up here from rubbing this area. So if you just kind of rub like that and you suddenly feel better, got these little buckles there that are making a noise, then that can sometimes be an indication of a wood element issue. So if you just kind of rub there and you think, oh, I feel good from rubbing that, you feel like, oh, I feel a bit of relief. Maybe you haven't had it build up to the point where you've got the stagnation yet. It's kind of like a bit tight there, and you've kind of moved it and you feel good. What are the things that reduce chi stagnation? Well, exercise, singing, laughing. Now, the laughing and the singing are because you're pushing air through this area. And when you're doing that, you're stretching out your diaphragm, you're relaxing it, you're allowing your lungs to kind of expand, the chest area to expand. And that's a big aspect of wood, you know, needs that movement, that expansion, that kind of thing. So those things may help initially. Pungent foods can help with moving that stagnant chi. Now, what's happening in this case is you've got a bit of wood invading earth. Now, that would be wood over controlling earth. When that happens, if earth is not strong enough to withstand the overpowering nature of wood, then it invades, the energy kind of invades it. And what happens is the earth's job is mainly digestion. So in Chinese medicine, we think about the spleen qi digesting the pure and impure foods. So separating the pure and impure. This transformation and transportation processes of the spleen is really all of your digestive functions. And to be able to do that, it relies on the movement of wood. So it needs that movement of wood. So if wood is overpowering it, sometimes either the person gets a very, very low appetite, they just don't feel like eating much at all, because they've got just this discomfort there from this pushing of wood, pushing into the earth kind of thing, that idea. Chinese medicine is very metaphorical, if you haven't worked that out by now. So sometimes I get people comment on this channel, they're a bit critical. Oh, this is not right in Western medicine. Well, this isn't a Western medicine channel. Yeah, it's not a Western medicine channel. So if you got this far and you're still watching, good on you, and you're thinking like that. But yeah, so just so you understand, we're not talking about the physical spleen and the physical liver. We're talking about, that's why I'm using the analogies of the wood and the earth, right? So this idea of movement is needed for digestion. That's what's happening here. That's what's the dysfunction here. So how an acupuncturist might approach this would be, well, if they checked your pulse and they could see that wood was getting too big for its boots, let's say, then they would use a strategy to kind of back the wood off of the earth. Same as with herbs, we would use that. Now, often we use like herbs to strengthen the earth so that it kind of grows stronger and it can kind of withstand a little bit more. It gets, you know, sometimes you think of wood and earth as like a bully situation, right? So if you've got a bully bullying you, you can either tell the bully to stop, but you could also make the person being bullied a bit stronger so that then eventually the bully stops doing that, right? Because the person gets stronger and then they back off. And that's kind of how we think about it in a herbal sense and an acupuncture sense as well. Sometimes you need to strengthen the earth and sometimes you need to back the wood off of the earth. So it could be either of those ways. Now, how are you going to know what needs to be done? Well, that's where the pulse diagnosis really comes into it. So the practitioner is going to be able to feel that exact thing because those two pulses are actually on different sides of your body. So we'll be able to feel what the imbalance is, and that's essentially what we're doing in pulse diagnosis. We're really taking into account, well, what are the symptoms that are going on, and then how did this start, or what needs to be treated first that's where we would know that from the pulse. And that's the beauty of Chinese medicine. It's so great because it's so, the pulse is telling you address this aspect now, and then you might need to address another aspect later. So quite often you might need to just remove that overpowering nature of wood, and then earth by itself will just naturally grow bigger and be stronger, and the situation might resolve. So what would happen is, if you backed wood off, maybe the earth would be less encumbered by the nature of wood, and the appetite might return, and so the person then would be able to put on weight because their appetite returns. Now, there's also complexity that happens when things have been going on for a long time. So if this has been going on for months, years, something like that, it's a lot different to something that's only just happened. Something only just happened maybe 2 or 3 weeks for something like this, or cold and flu things, maybe 2 or 3 days versus 3 weeks. You know, you've really got a big difference in how things have changed in the body. And what our bodies will do is they kind of change our functionality to be able to just continue coping and to continue to go on. And so in Chinese medicine, particularly classical Chinese medicine, we think of this idea of like functional change versus material change. So if something's only just happened, it's a functional change, and it's a lot easier to address that at that point than something that's had a material change. So this is where maybe herbs and acupuncture are really different. Like acupuncture is very good for these functional changes, maybe not so good for material changes. It can be used but for those things, but it's a much longer kind of treatment process. Whereas with the herbs, it's still a longer treatment process, but you might not need to see the practitioner as often, let's say, because you get onto a formula that's just working slowly in the background, and there's no other way to address these situations sometimes than this kind of ongoing support for these organs to make sure that they don't regress back into being deficient or being unable to perform their functions properly. So that's what I would kind of that's how I would kind of answer this question in terms of the weight loss and the appetite changes and the weight. So if your wood is too overpowering, that makes sense that the earth won't be able to perform its job properly. And in TCM, they think about this, they have this saying of like, this worry knots the spleen energy. So that's another thing where emotions themselves can have a direct impact on organs. So this might be another thing that you may have considered, may not have considered. Worry knots the spleen chi, which means it causes it to, like, have you ever had that situation where you've had something happen and you felt really horrible about it, and then you think, oh, I don't feel like eating anything, or your appetite's messed up? Like, it depends on people's constitution. Some people get a big appetite and they can't stop eating, and they tend to have this comfort eating because they're so worried, and they can't regulate that function of being able to stop. Part of it's emotional, like you're getting this dopamine release from having these delicious foods or comforty foods, but not able to regulate when you're full or, when you should stop, that sort of thing. So some of it's habit, what people just naturally have gone to over time. But it's a common thing where the spleen energy is knotted. What that means is it's stuck and it's sort of stuck and it can't perform its job properly. So you need the spleen chi to transform and transport the food and fluids that's going in it. So what then happens is if you do eat something, if that spleen energy is knotted, it isn't going to descend properly. Like your stomach energy particularly is what needs to descend. If your stomach energy just sits there or starts to go up, you'll feel nauseous, and then if it's really going up, you'll feel vomiting. You'll have vomiting. You won't feel vomiting. But nausea, it's like a feeling like you're going to vomit. And why does that happen? Because your stomach energy can't descend properly. It can't go down. That's its natural direction. And actually, in TCM, they call that rebellious stomach energy. It means it's just going in the opposite way. So those things can be kind of interconnected. It could be a situation where stress has caused the liver chi to stop flowing properly. So stress, in a Chinese medicine sense, often relates to frustration, resentment, anger. There's an idea in Chinese medicine where all the emotions can affect the liver in that way. I think because any emotion could lead to anger, right? Over a long period of time, something that you hold in and it's frustrating you, that leads to anger. But because the liver chi's needed to move and spread, it's just the lack of that, right? And so if you have a bad situation happen, you have something happen, and you feel a bit annoyed about it, and you're like, oh yeah, that's all right, I can let it go, But if your liver chi's already stuck, then it's very hard to let it go. It gets in you and it gets, and sometimes people feel like, I wish I could let that go. I wish I could just be free of that, but I can't stop thinking about it. It's really frustrating me. It's really annoying me. Or someone does something to you, like even you're driving along and you see people that get the road rage. Well, it's not that one thing that happened probably that caused them to get really that angry about it.
You don't have the answers though.
Calm down.
Because you're trying to give me advice about something. You ain't got.
They're already angry. It's already something happening. Or maybe they're not even just already angry. Maybe they're already sad, depressed, flat, not enough joy. So joy is the emotion that relates to the fire. So a lack of joy, just that sadness and that despondency. And then something happens, and because they don't have the joy, they've just gone straight to anger and frustration. And it's really, so emotions can affect this situation in that way. So emotions could affect the wood, the liver, the wood particularly, in this idea of this free flow. Then there's no free flow. That becomes chi stagnation. That wood energy is forcing its energy onto the earth. The earth can't do its job properly. And so then you get this low appetite. Or it could be the worry aspect of things is knotting that spleen chi. So it's really up to your practitioner to make that particular diagnosis. So this might not be the diagnosis they make, but that is the way, theoretically, that we would think about things in Chinese medicine. And just bear in mind, look, there's lots of systems of Chinese medicine. So this system I'm talking about now is kind of common through lots of different aspects of it. We call this the 5-element understanding, and that is the basis behind the understanding of the Zheng Fu, which is the stock standard TCM people that you are practicing Chinese medicine would utilize what we would consider a Zheng Fu system, which is these patterns of disharmony like liver chi stagnation, spleen chi deficiency, liver blood deficiency, heart fire. These kind of patterns of disharmony relate to Zheng Fu system. But this understanding of how those things interrelate is a 5-element system. Yep. Now there are practitioners that just practice for 5-element system in an acupuncture only sense, and that's called 5-element acupuncture. And that is really good for emotional stuff. So if you just simply, not that it can't be used for other things, but if you've got lots of emotional stuff that you want to clear or treat in an acupuncture way, I guess, to address that in an acupuncture way, then a 5-element system might be the better system to kind of look at, particularly if you don't have a lot of physical symptoms that you would really think about, but you've got a lot of emotional stuff that you want to address, then you could look at using a 5-element system. But for this person, the Zheng Fu system would be useful, or the classical Chinese medicine system, which I can't help but beat the drum about because I really like that as well. So I hope this has been useful and helpful to you. And if you have a question about Chinese medicine or acupuncture or something about that, pop it in the comments below. I'll do my best to answer it. I hope this has been useful and helpful to you, and I look forward to seeing you again on the next video. And don't forget to subscribe if you're new to the channel and you haven't subscribed yet. Click that subscribe button and the notification bell, and then you'll never miss a video from me when I make a video. Thanks so much for watching. Thanks for listening to the Chinese Medicine Podcast. I'm going to be talking about so that's another thing where emotions themselves can have my hair just put the hairspray in today. So that's another thing where